Reverting the question back to him, I asked him that would you want a tooth extraction or root canal or any painful procedure on you in which the option of anesthesia and analgesia is available to be done without the painkillers, to have a more natural experience. And he gets stumped and he's like, no, why would I do that? Why would I undergo through that pain? So I said, exactly, that's my point. When because of the advances in medical science, and if the options of analgesia and a painless birthing experience is available, why would you want to have why would you want your partner to go through that kind of excruciating pain just because on the thought of having a more established bond with a baby? So he gets quiet, and then I explained to him, this story aside, the point of this is that I want to explain a few myths regarding epidural. And number one is that it increases the chances of cesarean section. So what the data suggests and what research studies prompts us to, and nothing in the research studies or data suggests that it increases the chances of cesarean section. The only thing that it can do is that it can slightly prolong the second stage of labor, and can have increase the chances of an instrumental delivery if the patient undergoes delivery through a vaginal mode. That's the only thing that an epidural is going to do. It would increase the chances of an instrumental delivery and might prolong the second stage of labor. In my experience, what I've witnessed is that because of that relief that the patients get when they get an epidural, what happens is that they get the strength and stamina to endure labor. So rather than in the midst of the ongoing trial and opting for a cesarean section because of the refusal of trial of labor, they get that strength to endure the pains. And the pains are, sometimes it's completely painless, sometimes the patient does experience pain, but the pain is a bit more bearable. So what that does is it allows them and gives them a chance to dilate, and thus allowing the delivery through a vaginal mode. So these were the few things I wanted to discuss regarding epidural. And if you get an option for epidural in your hospital, I would strongly encourage you to have epidural as part of an analgesic option in your birthing plan.